This study was a secondary analysis of original work that we did back in 2009. The original study was looking at women that were treated with neoadjuvant systemic therapy and had MR imaging both before and after chemotherapy in order to see if the response rate on imaging translated into pathologic complete response rates at the time of surgery. What we found at that time was that approximately 60% of patients that had complete responses on MRI with high-risk tumor subtypes, so ER-negative type tumors, had complete pathologic response seen at the time of their final surgery. This secondary analysis was an update of that work looking at outcomes. And what we found was that women who had different types of surgery, so mastectomy and breast conservation, who received contemporary neoadjuvant systemic therapy, had excellent long-term outcomes. These women had very low rates of local regional recurrence, and in fact, in almost 1,100 patients, we saw only 32 local regional events. The predominant failure pattern was distant. However, 85% of this group, who had mostly stage 2 and 3 breast cancers, were completely free of disease. So it's important to remember this was a retrospective study. So this was a group of women who had neoadjuvant systemic therapy. So everyone had to have had upfront drug treatment, and they also had to have had an MRI before the drug treatment and then prior to surgery after the drug treatment. They had to have their final pathology available, and they had to have 1-year minimum follow-up. The group was a heterogeneous group, and again, it's important when we look at the results to remember that it is a retrospective study and there are selection biases. We found that women who had neoadjuvant contemporary systemic therapy had excellent outcomes when they had breast conservation. Our rates of local recurrence continue to remain low and will continue to likely improve over time as contemporary systemic therapies improve. At this juncture, I think we're not doing as good a job individualizing the surgical and local regional therapy as we are individualizing systemic therapy. With appropriate education, many women who are otherwise jumping in and getting bilateral mastectomies can have breast-conserving surgery with less surgery and recovery time. And I think that we have shown in this data set that these women continue to have excellent outcomes. We do. In fact, the original data set, which was 770 patients, was actually done in preparation for a study that is looking at patients who have neoadjuvant systemic therapy and have excellent outcomes in terms of pathologic complete response that's estimated by both radiographic imaging and a biopsy of the tumor bed. We are currently in the planning stages of the biopsy study through the cooperative groups. And if that study additionally shows that the negative predictive value of the biopsy on top of imaging is very accurately predicting pathologic response, then we will be able to move forward and test radiation alone in these patients and potentially avoid surgery altogether.